So the surgical phase. So what are our options for restoring this patient? So these are three terminologies that you need to understand. Really, the two that you need to understand is FP1 and FP3. So FP1 is literally, you're just putting teeth, a row of teeth. There's no pink, there's no vestibule, there's no prosthetic replacement of the gingiva. It's literally just white teeth on their gums. So if you look at the size difference between this, and this, it's a big size difference. Whereas an FP3 is, you're actually replacing the gingiva prosthetically. So when you're deciding, on this, what kind of case, you got to take all these things into consideration. I'll tell you that this is going to be your easier route. And I say that because this right here has got complications such as thinner restoration, so you have less restorative space. And also it's very difficult to make the tissue look good in a smile. And so it depends kind of what the patient's, cosmetic outcomes are, how cosmetically driven they are. I'll tell you that most guys are doing something like this because you're reducing bone, you're creating restorative space, you're getting a nice flat platform for all your teeth. You're prosthetically replacing the pink, so the pink looks really good. You got your papilla coming down between each tooth. Because you really don't see that. You kind of get that horse teeth look. Sometimes that's not a big deal. For an older guy that's got a little smile line, he doesn't really care that his teeth are long. But, somebody that shows a lot of teeth, or a younger patient, or somebody that's more cosmetically driven, that might be really important. That what they see is that pink papilla there. Some of the best dentists in the world that we watch and follow, they're doing this, but they're spending 2 years shaping the tissue and trying to recreate papilla between each tooth, and it's sexy dentistry, but that takes a long time to get there, to build up that skill level. And our patients, they want predictable, they want quick. So I personally found this to be easier, but here's the terminology. This is kind of the definitions. This isn't one that's commonly used, but it's basically, if you were to take this and not put pink on it, I guess that's an FP2. But I don't see this terminology used a lot. It's really just these two right here. Knowing that most guys are starting and doing more of these, because a lot of times you're treating these patients that have had perio and their tissue is receded anyway. And so you can't just put teeth. You got to think, how do I replace that lost tissue? Commonly, those are the kind of patients that you're working on.